So Gareth is coming from UK. He's specialized in sports, specifically. He's a consultant for British diving competitors. He has made how many Olympic Games have you already done?
6 now.
6, wow. So Gareth will explain us how to combine the Winback on active rehabilitation, specifically on shoulder.
Okay, so yeah, I'm conscious of time, so we'll move a little bit quickly through the initial bits. But for me, when I'm always talking about the shoulder, one of the things for me is always just to understand the basics of the muscle around the shoulder. And so when we go back to Tim Lieben's work, there's a surgeon did extensive work in terms of describing the muscle fiber types. And so you can find a lot of his work, but some of it gives a lot of clues as to the function of the muscle. And maybe when we're doing rehabilitation, if we understand the muscle groups that are involved, then we can actually vary our rehabilitation accordingly. So when we look at the muscle function, for example, the longer the fiber, we know the greater the velocity. And then the straighter the fibers are, the greater the excursion, in other words, the movement around the joint that it's able to produce. So when we look at that, the top two, we know that it results in creating movement around the joint. So the next thing is the greater the physiological cross-sectional area of the muscle, then we know that there's a greater force which is produced. And then specifically looking at the types of fiber and the angles that are involved in the fiber types. So if we're looking on the left one, which is a pennate type fiber, we know that the greater the angle, the greater the force production. And so this will result in muscles that provide stability around the joint. And really the reason for talking about this is a lot what I come across when it comes around to the shoulder is we've got to understand in terms of the rotator cuff, is it producing force, or is it producing movement around the actual joint? And once we understand that, then we're able to deploy the correct exercises. Okay, next slide, please. So looking at particularly the rotator cuff muscles, they tend to have short muscle fiber lengths compared to muscles like the deltoid or brachioradialis. And of note for me is the subscapularis has got the greatest physiological cross-sectional area, followed by infraspinatus. So when we're looking at those things, then basically what we're saying is that if it comes to producing force, that these are the muscles that really are concerned with producing force and therefore stability. And at some point in our rehabilitation, force has to become into the equation. So we have to progress past the use of activation exercises and banded work, for example, if we really want to get the true function of the rotator cuff. Okay, moving on to the next one. So when we're looking at so this basically lends us the theory that we do have that the rotator cuff muscles will be more suited to providing stability around the shoulder joint. And subscapularis really has the greatest cross-sectional area, and probably the one which produces the greatest capacity in terms of force. But a lot of the exercise out there tend to focus on the posterior cuff, infraspinatus, supraspinatus, teres minor. And so I think it's important sometimes when I'm looking at complex problems around the shoulder that the role of subscapularis really has been overlooked. Okay, on to the next slide. And so when we're looking at the actual, when it comes to strength, I mean, if we're talking about the Winback in terms of the active phase, I'm really looking at around the strength. So for me, rotator cuff strength is important to cope with the demands which is placed on the shoulder by daily activity or sport. In particular, this is repetitive. we want to maintain the optimal ratios between the rotator cuff muscle, and obviously we want to try and reduce the risk of shoulder pain, which is a very important thing for us. So just looking at where it's a little graphic, just looking at rotator cuff strength, and what was interesting was to see that isometric strength peaks in decade 5 and then starts to fall thereafter. So isometric strength is a really good way to monitor the basic strengths in the muscle, and so it's something that we've used quite extensively. Okay, on to the next one. So just obviously I was just talking about, we use our handheld dynamometers, and the literature would suggest that if you're looking at isometrics in the rotator cuff, you want to have be within 10% of the uninvolved side, and for throwing sports, the throwing arm should be 10% above the non-throwing arm and have an external-internal ratio of around 1:1. Typically, outside of throwing sports, I tend to work on a ratio of 80%, where the posterior cuff is 80% of subscapular strength. Okay, so in terms of, some people always talk about what are the targets in terms of strength that we're trying to achieve. For me, roughly, if I'm looking at internal rotation, I'm looking at 20 to 40% of body weight, and external rotation isometrics at 15 to 35% of body weight. Okay, moving on to the next one. So this is, this will apply to both the back four and the other versions, just maybe not with, obviously the back four has got the ability to integrate the different frequency currents, high EMS and high TENS, but effectively, when we're talking about developing strength, what we want to be able to do is to increase the ion channel activity within the cell walls. The increase in temperature, as Ignacio was talking about, really is going to increase in the length-tension relationships, and you get increased viscoelasticity in the tissue, and you have an ability to generate more force. We also know that looking at the non-contractile elements around the joint, you're able to improve joint mobility by just increasing the viscoelastic properties of the joint capsule. We know that with reduced pain, you switch off your pain inhibition response, and you get better neuromuscular recruitment. And then finally, the increased metabolism after exercise is going to aid recovery. Every time we're going to engage in some form of exercise and strength, we also want recovery after that. We want to repair the damage, but also at a later stage, we're wanting to induce the changes and to assist in the changes, and whether it's the increase of muscle tissue and muscle fibers, or whether simply just increased recruitment the next time we go around to exercise. The back four has the ability in terms of your high EMS to recruit the motor units, both superficial and deep. We can get improved lymph drainage. So if we're looking in the acute phase of injury, we're trying to activate muscle. Quite often, the restriction in terms of movement is because of swelling. So if we're trying to really to get joint movement, the lymph drainage is really important. And then the increased resistance of the muscle tissue is going to focus the effects of the TECAR on the muscle that is undergoing the high EMS stimulation. And then the high TENS, as we've been discussed, is really more about the analgesic effects from that point of view. Okay, so moving on to the next one. So typically, whenever I'm working with its shoulders, I'm always looking at the role of thoracic extension. Quite a lot of the time to get, if we got good thoracic extension, particularly with any overhead movement of the shoulders. Yes, we're always looking at scapular stability and scapular rotation, which is important. We're looking at the ability of the the rotator cuff to function throughout the entirety of the range of motion, but just to always have a look at thoracic extension when dealing with shoulder strain. Okay, next one. And if I'm using this is using the back three, but typically just having either the bracelets or the fixed pads on the arms, and then you can have it just below the T12, and just doing your normal kind of mobility exercises would be really good. And you can get and of course this using an RET type current, which for us has been very, very useful just in helping to increase thoracic extension. Okay, moving on to the next. So I'm a big fan of Jo Gibson and her work, and I think sometimes when we're looking and people coming to treat patients coming in with shoulder pain, and it's whether we need to have a very specific diagnosis or not. And to be honest, whichever way you go, whether you want to have a very specific diagnosis or whether you're going to be more functional in terms of your approach, Winback is going to help you in either one. So when there's and there've been times I've used both. I use both methodologies because sometimes I have limited time with a patient, and really the 4 steps to shoulder assessment is just looking to see what limitations do we have to rehabilitate the rotator cuff. So is there a really big tear that's in the muscle? So if there was trauma, or if age is a risk factor, and then the next thing we're looking at is stiffness. So we know from the current evidence that 70% of rotational range in all directions compared to the other side is needed for the rotator cuff to function efficiently. If we don't, we need to be considering frozen shoulder or osteoarthritis in terms of that. Is it an irritable shoulder? Ignacio was talking a lot about whether there's a lot of inflammation around there. And if there is, if it's very irritable, really, do we want to use other methods, or does it examine what is possibly causing that irritability around the tendon? So let's say it's something like a bursitis, an acute bursitis, sometimes may respond better to an injection. But yes, there are you can have use the TECAR therapy with that, but it may be just better to at that point to be referring. And finally, is the shoulder strong enough? And that's really going to be the focus of the next few exercises. Okay, next slide. So just looking for instance, if I'm just looking at the early stages of rotator cuff. So in the first video, it's just typically side lying. I'm really looking at if we're looking at, in this case, posterior cuff, to activate posterior cuff and the lower traps as well. So the position back 4 gives us the ability actually to have a handheld 1 kg return plate, which is very useful. And so it provides a little bit of weight, but it also means that it becomes the return plate. So actually just working through typically rotation and then kind of rotation, a combined movement going into abduction, where you're actually starting to look at the movement of the scapula as well while you're doing that. And that's all in side lying. And so that's looking at the first 2 is kind of looking at posterior cuff. And then in terms of the second 2 video, we're just looking simply at external, so eccentric, the movement of internal rotators, and then also combining that movement with the scapular protraction as well. So I'm always a big fan of, yes, one isolating exercise, but then exercise that is also going to start to combine the different movements of the scapula as soon as possible. Okay, moving on to the next one. So moving on to, let's say if we're looking at scapular stability, so we know just in the first one, if you're using either back 3 or 4, you can just use the fixed electrode, and that's our wall sliders. And the second one, you're just increasing the difficulty by using the resistance as well. If you're looking specifically just around scapular stability and starting to train that at a low level, we're using the ball through that. And probably the last video is one of my favorite ones, and it's just getting someone to hold a gym ball and just compress the gym ball, so you're getting activation of subscapularis, and then you're just hitting the ball so that you're creating just a vibrating effect, and that really is very good for stimulating the entirety of the rotator cuff. And we talked about generating the force generating capacity of subscapularis and the rest of the rotator cuff, and you're doing it both in neutral and in elevation, just in terms of increasing the difficulty through that. So particularly if there's been a little bit of pain, just doing that with the current has been very, very effective in that. Okay, moving on to the next set. So really enjoy using inverted kettlebells. We know there's, I think it's quoted later, but the research also indicates that just using grip strength alone has been shown to have positive outcomes on rotator cuff strength. But in terms of now introducing proprioception, in terms of producing dynamic stability and bringing in grip strength as well, the inverted kettlebell has been really, really good exercise. And then just moving to the next, just using typically your internal external rotation. You can either do that just as just the standard rotations where you're just pulling in, or actually as an isometric where you keep the shoulder in a fixed position and actually walk away, so that you walk to the sideways, so that you're actually increasing the tension in the band, and then walking back towards the band, so that you're decreasing the tension in the band. And that works as a very good isometric. The further away you walk, the more you recruit the muscle from that. And then just looking at again, I like to start combining a lot of the close chain type exercise as well. So whether it's serratus anterior activation in 4-point kneeling, or starting to go into planks, and then from there increasing the progression, maybe coming up to the hands, going down to the elbows as well, and looking at both the scapular function and your serratus and anterior cuff stability in those positions. So you've got a number of progressions that you can follow in terms of that, but the key thing for me around all of these movements is that I'm very quick to start to generate, to focus on the force producing capacity of the muscle. And so being able to do that early on, whether it's just simply in sideline with a 1 kg weight, and you can choose whether you're going to add things like blood flow restriction training, with that, use things like the flywheel for example. But the really important factor there is, as soon as possible, looking at small ranges of motion, looking at stimulating the force generating capacity of the muscle. And that really has been the mainstay of the shoulder rehab. Right, I think that's all from me.